Hi, and welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today in the show, we have Christy Huff. She is a cardiologist, and she is co-director of the Benzodiazepine Information Coalition. She wrote the KevinMD article, The Updated Benzodiazepine Boxed Warning, What You Need to Know. Christy, welcome to the show.
Hi, Kevin. Thanks for having me here.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. So I started off as a cardiologist and I was in private practice in 2011. And after that, I was out for a few years because I wanted to stay home after the birth of my daughter. And I had plans to go back to work after she was in kindergarten. But unfortunately, all that was derailed when I was prescribed Xanax. I was having a medical crisis back in 2015, and they just wanted to give me a temporary prescription to kind of get me through it. I was having trouble sleeping. Unfortunately, within a few weeks of just taking a low dose, I became physically dependent on the medication, and I began to experience something called interdose withdrawal, which means that because of the short half-life of Xanax, I was having withdrawal symptoms in between doses. And at first, nobody knew what was going on. I didn't, neither did my doctors. And I went through a lot of medical testing. And then later on, since everything turned up normal, they just assumed I was having anxiety. I finally figured out what was going on with me just by an internet search. I found Benzo Buddies, which is a community of patients online that are helping each other, supporting each other through benzodiazepine tapers. And what I read there was pretty shocking. It confirmed the diagnosis in my mind that what I was experiencing was related to Xanax and that I needed to come off of the medication if I were ever going to get better. Specifically, I read about the Ashton manual there. Heather Ashton was a British psychopharmacologist in the 80s and 90s, and she ran a benzodiazepine prescribing clinic, and she followed patients coming off these medications. And the manual is basically the culmination of her work, describes the benzodiazepine withdrawal syndrome, and also has protocols for coming off the medication. So I took this information back to my doctors, and I was actually met with a lot of resistance. I went through several doctors before I could find someone to help me. And I know in retrospect now from the work that I do that this was because there's a big knowledge gap with physicians surrounding benzodiazepines. So eventually I did find a doctor to help. We transitioned me over to Valium because the long half-life helps cover that interdose withdrawal that I was experiencing, and I was able to taper off the medication. Unfortunately, it was a very prolonged and difficult taper. It took me over 3 years to come off the medication, and it was utterly disabling. After my experience, I decided I really need to speak up because I'm not an isolated case. I met many other patients along the way who were suffering the same thing, who felt like they weren't getting medical support and they were having really difficult withdrawals. So in 2017, I became director of Benzodiazepine Information Coalition, and it's a nonprofit that educates about the adverse effects of benzodiazepines. I specifically advocate for better physician education on these issues and informed consent for patients, and then safe deprescribing and prescribing practices surrounding benzodiazepines.
So you were prescribed Xanax for a few weeks to help you sleep, and you started feeling these interdose symptoms. So tell me exactly, what were you feeling in between your Xanax doses?
Yeah, that's a good question. So at first, things were pretty subtle, and I developed a tremor, and I developed anxiety. And it was kind of strange because it was the anxiety always seemed to show up in the afternoon, but I didn't really, place the timing of it. And then as things progressed over the next couple of months, I was undergoing all these medical tests, and I just continued to get sicker. And so the symptoms progressed to the point like the Xanax dose would only last for like 2 hours. And then I would be in florid withdrawal. Like I felt like I had an elephant sitting on my chest. I couldn't breathe. Mm-hmm. I couldn't swallow. My heart was racing. I was only sleeping 3 hours a night. So it just progressively got worse over a couple of month period.
Can you share what your initial dose of Xanax was?
Yeah, so I initially started taking 0.25 milligrams just at night to sleep. I was prescribed to take zero point 0.5 milligrams 3 times a day as needed. And then as I developed this daytime anxiety, my doctors actually encouraged me to increase the Xanax dose. Mm-hmm. So before I figured out what was going on, my Xanax dose was up to 1 milligram a day at most.
And you mentioned you went to your doctors with these symptoms and they were hesitant to take you off the Xanax. What did they tell you to do instead?
Yeah, so they told me a lot of different things. I was pretty adamant first that I needed to come off of it. So, one thing they did, they started me on an SSRI to help treat the anxiety so I could hopefully get off the Xanax. Unfortunately, that actually made my anxiety level go through the roof. I just couldn't tolerate it. I had one provider tell me that there's no way I could be dependent on Xanax and that I could just stop it cold turkey and it would not be a problem. Of course, I had already tried to come down on the dose by myself, and the withdrawal symptoms were too strong. So I was told a lot of things that weren't correct, unfortunately.
So let's transition now into the KevinMD article that you wrote. This was back in March. It's titled, "The Updated Benzodiazepine Boxed Warning, What You Need to Know." Now, for those who didn't get a chance to read that article, can you just walk my audience through it and share the story of why you decided to write it?
So in September of 2020, there was an update to the current benzodiazepine box warning, and it was to warn of the serious risk of addiction, abuse, physical dependence, and withdrawal reactions. For those of you that might not know, there already was a benzodiazepine box warning since 2017 for in combination with opioids, and this was just an update to add these other risks. So the reason I wrote this is it happened in the middle of the pandemic, and so I really didn't want it to fly under the radar. And I do think this information is timely because benzodiazepine prescriptions have actually risen during the pandemic, and also the pandemic has generated a mental health crisis of sorts. So we need to pay attention to what's going on with benzodiazepines. When I saw this boxed warning, I was really excited because there was some of the things that are in the warning. Benzodiazepine safety advocates have been saying for years. Mm-hmm. And I wanted to write about the things that they got right, and also what I perceived as still lacking in the warnings. The reason the FDA did these or released these warnings is that they put together a task force of sorts to review issues surrounding benzodiazepines. And what they found, showed evidence that they need to strengthen the warning labels. So, and I was specifically able to obtain the task force report by freedom of information request. It was a 175-page report that I read through. And, when I was writing this article, I wanted to look specifically at the issue of physical dependence and withdrawal, just because there seems to be a lot of misconceptions and miseducation surrounding these issues. Of course, addiction and abuse are problems with benzodiazepines, but as they noted in the FDA warning, they are more likely to be seen in the setting of polysubstance use, and not so much in the populations of patients, like me, that were just taking them exactly as prescribed. So I did start the article with the story of Bobby. She's a physician assistant who was developed side effects from her prescription clonazepam and was forced into medical detox by her state medical board. She was taken quickly off the drug, and she developed severe neurological symptoms that were disabling. And 8 years later, she hasn't been able to go back to work. And I just used the story because, I wanted to illustrate how severe the benzodiazepine withdrawal syndrome can be. And I also wanted to share about the FDA adverse event reporting system because I helped Bobby actually file a report. She was really wanting to share her story, but she was unable to type it in herself. And it's so important that we report any kind of adverse event like this to the FDA so that They can change warning labels if needed.
Mm-hmm.
So as far as their findings, I just picked out a few of the interesting findings that I think gel with what we see in advocacy, specifically regarding physical dependence and withdrawal. Their findings were based on 104 cases that were reviewed from that database. And here's a few of the things they found. They found that adverse events can and do occur at their therapeutic doses. You don't have to be abusing the medication or taking high doses.
Mm-hmm.
Withdrawal can also be a very long process, can be years in some cases, like happened to me. And they specifically, I was very excited to see the mention of protracted withdrawal, because up until this point, it hasn't really been documented, and patients suffering it haven't been, believed, because there's just not a lot of awareness on that issue. They also found that physical dependence can occur in days to weeks, which is what happened to me,
Mm-hmm.
and that abrupt and over rapid tapers are harming patients, patients just like Bobby. And they did note in their report that physician education is lacking in this area. So, the upshot of the warning, the FDA had specific recommendations for judicious prescribing of benzodiazepines, which means use the lowest dose for the shortest time possible, or use alternative drugs. And for deprescribing, to use a gradual taper. And I think these are great recommendations and something that we can all really get on board with. But I do think the warning label could even be stronger, just based on my experience and what I've seen during my advocacy work. So, first of all, they said do a gradual taper.
Mm-hmm.
And it's good that they specify that it should be based on patient symptoms, but they really don't give a lot of guidance or any sort of protocols of how to taper patients off safely. The other thing is they don't really note that gradual tapers don't always completely remove withdrawal symptoms. I had a long, slow taper and I still suffered symptoms during that time. And the last thing that is, very important is that protracted withdrawal, if you look at the language on the warning, it appears that it's rare. But in Ashton's work, she says between 10 to 15% of people coming off long-term benzodiazepines, they will experience this protracted syndrome. So it's not a small number of people. And there's really no inkling about how disabling the syndrome can be as well. And, we think this protracted syndrome is related to neurologic damage just from prolonged use of the drug. It can take years to resolve and even potentially be permanent in some cases. And unfortunately, the research in this area is scarce, and we just need more so that we can figure out, how can we prevent people from suffering this syndrome and how to treat it if they've developed it.
So I'm an internal medicine primary care physician, and I have some patients on benzodiazepines. In terms of the gradual taper, what exactly would a gradual taper look like?
It's going to differ with the individual. I would say that if you look at feedback from the online benzodiazepine support groups, they're saying that less than 5 to 10% of the current dose monthly is a good taper rate. Now, some people are going to be able to go faster. Some are going to have to go slower. And then, as far as the timing, it could take many months. It could even take years. But I think the big take-home message is you really want to taper the patient at a speed that they can handle and adjust the taper rate based on their symptoms.
Now, what would be some use cases for benzodiazepines wherein medical literature would support its use in 2021?
So I think it's useful in very short-term treatment of anxiety, panic disorder, treatment of acute alcohol withdrawal. Sometimes it's used for short-term treatment of muscle spasms. I think just the key that it should always be used short-term or very intermittent use just to mitigate the risk of developing physical dependence.
So in the medical literature and in lay media, there's a lot of talk about the opioid crisis. And right now, physicians are being more judicious in prescribing opioids. Are you seeing the same thing and the same trends as it relates to benzodiazepine prescribing?
Yes, I definitely am. And I don't think that's so much a problem on the front end as far as prescribing new patients, but the problem that we run into and see most often is that patients are being cut off their medication too quickly because physicians are being reactive and they're sort of panicking and they're saying, I need to get the patient off now. But unfortunately, that leads to a lot of long-term damage for patients when they're being cut off too quickly.
We're talking to Christy Huff. She is a cardiologist, and she wrote the KevinMD article, The Updated Benzodiazepine Boxed Warning, What You Need to Know. Christy, you mentioned there was a lack of physician education when it comes to benzodiazepine and benzodiazepine prescribing. What would you say are the number one or two top issues that physicians need to know about?
Yeah, so I think the biggest issue is I would want to know or want them to know is about the gradual taper and basing it based on patient symptomatology and just not being reactive, like I said earlier, and feeling that you need to get the patient off the medication too quickly. It's really a marathon and not a sprint. And the other thing that I would really hope physicians do is put, adverse effects and physical dependence and withdrawal symptoms on your differential diagnosis. So you really need to have that in your mind. Because, I asked my physicians repeatedly, like, could it be the Xanax? Could it be the Xanax? And everyone just always said no. So that really just needs to be, I think, top on your list.
And my final question, what's your take-home message that you want to leave with the KevinMD audience?
I want you to know that benzodiazepines have some serious risks and harms. And I think patients really need to be receiving informed consent about these medications before they start. We've even thought about the possibility of written informed consent. And I actually authored a written informed consent form that's available on our website. Another thing that I'd like you to do is check out the hashtag World Benzo Day, because World Benzodiazepine Awareness Day is on July the 11th, and patients share their stories with benzodiazepine harm. And I really think these stories speak for themselves, and it's really the reason why I am participating in advocacy. So I hope you'll check those out.
And how could people reach you?
I can be reached on Twitter at Christy Huff MD, and our website is benzoinfo.com.
Christy, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks, Kevin.